Mary Ann will take attendance. Welcome, everyone.
Yes.
First order of business is to approve the July 15th, 2020 minutes because inadvertently they were left off last times. Can I have a motion to approve the July 15th, 2020 minutes? Thank you. And a second?
I'm sorry, who made the motion?
I thought I saw Alyssa's hand run up there.
Alyssa, okay. And then
And a second.
Michelle.
Thank you,
Okay.
Michelle. All in favor for approval? Aye.
Aye.
And opposed? And abstentions. All right, November 2nd.
Okay.
A motion to accept the November 2nd minutes. We'll do Michelle this.
I'll make a motion.
Okay, and a second. Thank you. All right.
I'm sorry,
Any
who seconded,
discussion?
Alyssa? I'm sorry, Alyssa, you seconded on that one?
Yes.
Okay, thank
I'm
you.
sorry, I was on mute for a minute. I
Oh,
apologize.
okay. Yeah, and I'm looking down writing, so I
No.
didn't see. Okay, thank you.
Any discussion? All right, all in favor? Aye. Opposed?
Okay.
Aye.
Okay,
Aye.
no abstentions. There's nobody to abstain.
Okay.
Okay, thank you. Any general public comments, questions from anyone?
There is nobody attending from the public at this time.
Okay. Moving on, the new business item that we had tabled is here. And the first thing we need to look at, I would assume, I need a little guidance here, is the job description.
Correct.
Okay.
Everybody has a copy of that job description?
Yep.
Yeah, good. I have a couple of things I want to address. And one is, it says 3/4 of the way down under general statement of duties. It says assist director of nursing with performance evaluations of nursing staff. And she's really not a supervisor. And even on the second page, when it says supervision exercised, it says none. So evaluation is supervision, and I don't think that that should be part of her responsibilities.
So by including that, it spoke more to gathering the information necessary for the process, as well as because the nurse, the person that I work with is very directly involved with knowing when the statistics are handed in on time, their overall performance and demeanor. That's really why that was included in there, to assist me
Well,
with the process. I don't know if
it's
I
not-
need to add a word.
Yeah, it has
It's
to be
not
very
clear,
specific.
it's not clear that it's not a
Yeah.
supervisory
Okay.
task.
Mhm.
So we could add with process,
Okay,
because it sounds like that you conduct evaluations and you assist with the conducting of them.
yes, right, okay.
Um,
I'm not opposed to that with process being added.
Madam Chair, if I may.
Yes, please.
Yeah, so if I could frame a little bit, I think you have to answer, I think the commission has to answer another question first before it gets into the nitty-gritty details of the job description. I think you, and Mary Ann, tell me if I'm right or wrong here, but I believe you have to answer the question of whether this is meant to be included under the Rule 1, Section A exceptions to civil service.
Okay,
Yeah, so I think you
Mhm.
kind of have that discussion first to see.
thank you. Okay,
Right.
because we have to see if this is even something that can be looked at
Exactly.
and approved.
Yes.
Okay, absolutely. All right, so let's turn our attention to that. Everybody has a copy of that classified service Rule 1?
Rule 1, Section A is the.
Yep, section A.
And if you don't mind, I could probably just read the.
Please,
There's
lead
only
us
one.
through it.
Yeah, there's only one. I mean, so Section A says essentially, and I'm paraphrasing, but essentially says everything civil service except for, right? And one of the
Right.
except fors is professional employees of the public health nursing service.
Right.
So the question is, and so I think Lynn, if you want to ask Lynn some of her opinions, Lynn would believe that this job falls under that, meaning that it would not follow the regular civil service rules. And so I think that's the question for you guys is that looking at the job description, understanding what it is, hearing from it, do you think that this is something that would be exempted here from civil service under the professional employees of public health nursing service line of the civil service rules?
If I could just say one thing, I think that in my mind, I looked at the job description first because I wanted to know what was happening. And when prior to the meeting, of course, when I looked at that, it seemed to me to be a clerical job. And that's why even when I questioned that one item about supervision, it didn't seem to fall in line with the outline of this job. So then you're right, Tom, when we go back to this piece that talks about the professional employees, and then we look at what does that mean? What is a professional employee? Alyssa, you want to jump in here at any time?
Yeah, I mean, to be a professional under the FLSA, you want me to explain that kind of aspect of it?
Well, whatever you think
Yeah,
is
I mean,
pertinent to this.
So anything that it's really a percentage. So to be a professional, you have to have probably 75% of non-administrative work. That's the basics. A lot of judgment calls, thinking, you could be administrative, but it has to be judgmental administrative. So if you can say that a big portion of this is judgmental and not tactical, then it'll be considered professional.
All right, I had attached from the, with the backup for the agenda, what I found as a definition of a professional employee is a person who works in a field of specialty that requires advanced education or training. Professional employees must have a substantial degree of freedom related to how they perform their job functions. They generally also have some control over the hours they work.
And when you look at the qualifications that are demanded to perform this job, if this were to come to pass, graduation from high school is.
That's not necessarily a qualification of a professional. It just
What
a
you mean?
qualification from high. So that's just one aspect of it.
Right, right. So, but there's nothing here that talks about any kind of, if we follow along with the idea that a professional is someone who has to have some kind of specialized training and other people just can't step in and do it. So, and I don't see any of that under the qualifications. That's all I'm
Well,
saying.
I don't think that anybody on the regular civil service administrative list has the medical training and background, which I would want for this position, which we need for this position.
Lynn, can you talk, I'm sorry, Madam Chair, if you don't mind, can you talk a
No.
little bit about what you mean by that, the medical training, the background, what's required of, in your mind, of that position? to really
Well,
work?
their knowledge of terminology, knowledge of skills, the ability to be able to do things like blood pressure checks, temperature screening, assist with vision and hearing screening for the school nurses. To be able to, part of this role is to support the nurses through COVID and to be able to be assisting them in something like an isolation room. Being able to be familiar with using how to use an N95 mask, things that differentiate that someone who seeks to be involved in a medical setting and has the experience and training to be involved in a medical setting. Also, you know, this role as it originated was somebody that helped out in the health office quite a bit. So for example, if a nurse is leaving the health office to go respond to another emergency and this person is back in the health office, one of the reasons why they need to be CPR certified is because oftentimes nurses have to leave health offices quickly. And if they're leaving the children in the care of another adult, that adult should be CPR certified. That adult should have some first aid training so that they can be able to assist a child who might be there that they were left in the care of, to participate and to be able to safely help support the nurse.
Can I ask a question?
Sure.
In terms
Please.
of how you think, or is this what you've described more of a manual? Can someone follow a manual and do these things, or do they have to have judgmental, use judgment to do and perform these tasks?
They do need judgment to perform this. So you need to have a set of assessment skills. So you need to be able to assess a situation and be able to act. It can't be, oh, let me go look this up in a first aid manual. You need to have the knowledge and the experience to be able to act. Because to be able to have to go look something up is going to delay care. But that's just one aspect of the role. But it is different from just someone who, you know, is looking to be an administrative role. This is a very unique role. There is no other role that exists like this. And as I was talking with Tom before, you know, some people have this perception that school health is, you know, giving out cough drops and Band-Aids. School health is not that anymore. School health is a very specialized practice, and it also differs from any other medical setting in that, you know, while you bring your skills, you know, to the medical set, even for nursing, when I hire a nurse into the school health role, everybody, when you're a nurse, you bring bits and pieces of wherever you worked to whatever job you're going to. But there is no one job that can prepare anybody to be a school nurse other than school nursing. So you might have skills that you take from the emergency room that you bring, and you might have skills that you take from, you know, the pediatric practice that you worked at. You worked with kids and you worked with doctors, but that doesn't prepare you for supporting people in a school health role. And it's the same thing with this supportive role. It's a very unique role.
And given that our decision is, regardless of how unique the role may be, our decision is whether or not this falls under civil service or not. And so I do think that help me if that isn't the issue before us.
Right. Yeah. If I may, I think you've summarized it. Does it fit under that line, professional employees of the public health nursing service or not? It's
Right,
as simple as that.
right.
I mean, you guys, I guess, could change the rules to create another exception, but if you don't believe that, but that seems to me to be, is it in that category or not, is the question.
I think the only thing my question is that the qualifications don't match up with the job description.
That's right.
So that's where I think it gets a little bit unclear, because what's in the job description is it's definitely hourly employee. What
Right.
you have in the requirements and the qualifications are expected out of a professional. Does that make sense?
Well, it's
And
what I need and what I have. So you know, my goal wasn't to match up what I guess I'm missing the point of it, but I mean, I don't
So
know.
if I look at this job right now, I would say this is an hourly employee without looking at the qualifications, without a doubt, because everything is tracking, assisting, tracking attendance, coordinating, clerical, that's all administrative, and that's all exempt, non-exempt. When you go down, and this requires a lot more than what you have on top. That's my issue with the job description.
could I also ask, how does a person attain this knowledge that you list under qualifications? How does one know how to do any of those things?
By working at a medical office and by being a health aide, or by actual hands-on experience. You know, you can get training to be either a CNA or home health aide, or working in a physician practice. being a medical assistant.
I think it's a non-exempt position.
It's
Yeah,
a medical
yeah.
secretary, like a medical secretary. A
right.
doctor's
No, medical secretaries just track data. They don't do hands-on stuff. Medical assistants do hands-on stuff. So this is a combined role of paperwork and hands-on is really what it's meant to be. So, and perhaps, you know, I needed a tutorial on how to write a job description because
No, I
This-
think you have everything that
Yeah,
you.
I don't know if I use the right adjectives or not, but it's not a medical secretary. Medical secretaries enter data, answer telephones, and so on and so forth. The medical assistant actually does more hands-on stuff, and you know. But again, this role existed before I even came here, in that it was, you know, heavily school health based, and that's where we need the support right now. That's where we're drowning with COVID. That's where we need to, you know, get back to getting help with this.
but we're not really denying the fact that this is a job that might be needed. That all we're saying is if this is something that is needed in this town and this is part of the and it's budgeted, what we have to do is decide whether or not it's a civil service job, and I seem to think that it is.
Well, if it
So,
is indeed approved to be a civil service job, I would, you know, either request that the person that I have in the role be actually allowed to resume in the role and be grandfathered into the role, or that a separate test and exam be created for the role. Otherwise, if I'm not allowed to let the person that's currently doing the role stay in the role, I don't know how I'm going to be able to train a new person. It's going to be a real hardship on me to be able to do that.
Lynn, you just hired her less than a year ago,
That's
And,
right.
you
Yes,
know.
and it takes
and-
actually, Marianne, in school health, as being the cyclical in nature, it takes a good full year before anyone really understands school health, and she's completed a full year. And not only that, she is extremely bright, extremely
Yeah, but we
intuitive.
can't.
Yeah.
Well,
So I'm just asking a request, if you can support me in that role, that if you decide that it's civil service, that I be allowed to keep the person that's already doing the job. Otherwise, it's no help to me. It's just not.
Well, I can tell you right now that in the past few years, I can tell you of 1, 2, 3, 4 departments that had part-time people, that the jobs were made full-time, and all of those people had to take a
Yeah.
civil service test.
Were all of those people in the same situation that I am now, Marianne? Were all those people experiencing
Yeah,
the
but-
same direct impact of a global pandemic that I am right now? Did the people that you have on your civil service list right now, will they be able to do the things that I need them to do to help me run this department?
Well, that's
the-
why we have to go out and post the job and advertise, and we will give a test, and you'll be able to choose
And
someone.
which test are you going to give? Are you going to create the test for this exam?
Well,
wait, just a moment, Lynn, I don't think that there's a person here that doesn't agree that you probably need this assistance. I don't know anything about the town's ability to write an MOU or to during this period in which we're waiting for a permanent employee to come on board. If there's anything that the town can do to assist you, I have no idea. That's not in our purview as far as I'm concerned.
yeah, you could temporarily increase her hours. I don't see that she's been working any extra hours, but she can, and I think you're aware of that.
She can't. She either has to, she's going to seek employment elsewhere. She has personal situation now, and that's, I know that doesn't matter to you guys, but I will
Well,
be
it
without
does
a
matter,
person.
but it
It
can't
will, and
enter
it will
into our
cost the
decision.
town more money. It will end up costing the town more money because you're going to have to hire a new person. And if it's anything like this process has been for me, it will be June before this person is hired.
Why can't you get another part-time person? Get 2 people.
I don't have
keep
time
her,
to train anybody, Marianne.
but
How am
you-
I going
you'll
to train
let the
somebody?
person that's doing the job
How are they
train.
going to train the person? And then that's taking them away from doing the work that needs to be done to train someone. It takes a
Madam,
whole year to train
Yeah,
somebody.
please, Tom, jump in
Madam
here
Chair, yeah.
anytime.
So I kind of think we're getting, I mean, you're the chair, so I don't want to interrupt, but
No,
so
no,
I do think you need to, I think you need to officially make the decision about whether it's
Right.
upward civil service or not. And then I
Right.
think you do have the second question is is what the process is. I mean, you can determine what the hiring process is, and Mary Ann, I think, strongly believes that there should be a testing process, and Lynn strongly believes that the person that's in there due to the pandemic should stay and be grandfathered essentially into the position. But I don't think you get to that second question until you answer. I think I know what the answer is to the first one.
Well,
But
first of
but I think
all,
you need to take the official vote for that and then
Mhm.
I know-
answer the second question.
now I want to mention something. This is a special meeting, and we're only supposed to address what's on this meeting, on this
Right.
agenda.
Right.
Okay.
What else
we-
are we talking about?
Yes, not only that, but I don't think at any time, I know I'm not prepared to make any further decisions other than this that's right before
Right.
us now.
I think we have to.
How the town just determines the assistance that Lynn would get from here on in, I'm not prepared to make any of those decisions. So, Tom, to your point, I really do need to hear a motion about whether or not this is a civil service position. And as the chair, I have to say that I think it is clearly a civil service position, not only because of what we see here, but because of what we know in past practice and what we've done in the past. So can I hear a motion to, I want to get the right word.
Agree?
What was our initial, I can't find my
The
agenda.
position was a civil service job.
Yeah, the classification.
Classification.
Yeah.
I agree.
Okay, so the motion before us is that, and I need a second.
Second it.
Thank you,
Oh,
Barbara.
Barbara, when did you come here?
Yeah, she-
I came almost at the beginning, but the
Oh,
ID number you had me click into to get to the Zoom, it wouldn't work, and it said it's the wrong number and all that stuff. So I searched around on my computer and I got in somehow. Don't know how.
okay.
Okay, so we'll, so we'll have a discussion in just a moment, Barbara, if you have anything that you want to add to this. So the motion before us is that the position, the proposed position, be classified as a civil service position, and it falls under the civil service rules and regulations. Any discussion? Anybody? All right, all in favor of following the civil service caveat that this be a position, all say aye.
Aye.
And opposed? And abstentions? All right, so moved that this is a civil service position, and in order to make sure that Lynn has as much support as possible, I would ask that Tom and Mary Ann address that issue with her in the town, and if we need to be involved in further decisions about that, let us know.
Okay.
I'm not sure that we, Mary and I have the power to not test unless you guys tell us to test, to not test. So, I mean, if there was going to be a discussion about that, I think.
Yeah,
Because I think
So-
we have to test unless
Well-
you tell us otherwise.
Yeah, I mean, is this something that we're supposed to be discussing now? Because it's not on the agenda.
well,
I think we should.
I think that, go ahead, Alyssa.
I believe that we should conclude it. My only thought, though, is, so let's say it's a civil service position. Can Lynn's person who's already in the position apply for it as well? Or does she have, or we have to bring it out to the outside?
No, she can apply. No, she can apply.
She can apply.
Yeah.
As part of
Yeah.
a larger process, yes.
So she can
Right.
still currently be employed and still apply for this position.
Right.
Yes,
And Lynn, you're ultimately going to make the decision.
Yeah.
And with this, how fast is this process? Because
so I was just going to address that. So in order to expedite the process, in order for it to be fair and to do all that we need to do, the minimum amount of time that is required under the civil service rules for advertising and testing for this position I'd like to recommend the minimum amount of time so that we can get Lynn her
Yeah.
help just as fast as possible.
Again, this is a special meeting and it was only that one item. So, I have another
I'm just
meeting coming
advising,
up.
I'm not,
Okay.
no voting. I
So,
just want
all
to
right.
say that
Yeah, we
personally,
can do
I think
that.
what has been
Mhm.
expressed by everybody here is that we understand the need
Mhm.
for this position and we would appreciate an expedited process. That's all.
Right. And we could always increase her hours as a provisional. We could provisionally put her in there and have her
Great.
work 35 hours a week.
Whatever works, you
Okay.
know,
So
so
I
that
will-
Lynn can,
Yep. So I'll put it on my next agenda to decide on what type of testing we'll be doing for this position. And we'll get it posted and we'll advertise and,
yes, let's do it.
okay.
Yes.
When is the
Okay.
next meeting?
The next Wednesday, I believe, the second Wednesday of every month, the 11th. I believe it's the 11th.
So
But
next,
in the interim, like
Yeah.
she said, you can move her to 35 hours.
Yeah,
Yeah, move her up.
move her up.
I don't know what budget that's coming from, though. I wasn't really given permission to do that
I
unless,
thought you were. I thought you
only
had.
if the other positions went away. So I would have to do a PAF in order for that to happen.
Well, you sent a PAF already, so I
Right,
don't
but the-
understand.
So,
To
but the
increase
PAF
her
was
hours.
sent back to me. The PAF
I
was
don't
sent-
think, yeah, this is not a
Huh?
civil service
Yeah,
commission.
can we
Yeah.
stay on after and
Okay.
talk about it?
All right.
So,
Okay,
okay.
all right. Well, let's adjourn and we'll let Mary Ann
Okay.
and Tom and Lynn make everything happen.
Thank you.
Okay,
All
great.
right.
Thank you, everybody. Appreciate it.
You guys
Okay.
next week. Bye.